Well, it may be another reason for those suffering from obesity to consider undergoing bariatric surgery. A new study from McGill University suggests that morbidly obese patients who have the surgery to reduce their stomach size have an 80% chance of lowering their risk of developing cancer. With more on this, we're joined from Washington by the study's lead researcher, Dr. Nicholas Christou, and from Montreal this morning, Jennifer Schultz, who has had bariatric surgery. Good morning to both of you.
Good morning.
Good morning. Let me begin with you. I mean, just really wonderfully impressive numbers when you're looking at some of the research. But let me ask you, Jennifer, you decided to have bariatric surgery. Tell me why and when.
4.5 years ago, I decided I had battled with my weight all my life, and I'd finally come to terms with that I would always be obese, but I realized that I wouldn't live very long, and I had a teenage daughter at the time, and I wanted her to see her grow older and possibly have her own children, and I was worried that I wouldn't live long enough to do that, and I found out about bariatric surgery and decided to go ahead with it.
And at the time, I gather you were somewhere in and around 275 pounds?
That's correct.
And how much did you lose?
I've lost 130 pounds.
Wow. So this is obviously great news for you. Well, your story is a great story, but in addition to that, the research results.
Absolutely. It's very important, and I feel like I'm very fortunate to have had the opportunity of to have the surgery and avoided, hopefully, cancer.
Well, Dr. Christou, tell me what the difference is between weight loss in general, let's say through diet and exercise, and maybe the lowering the risk of getting cancer in that scenario, as opposed to bariatric surgery. Can you kind of walk through that for us?
Yes, I think that it is important to realize that weight loss in any form is likely to afford some protection from all the comorbid diseases that are associated with obesity, including cancer, which is the focus of our study. Weight loss surgery targets a population at the extreme form of obesity who cannot lose the weight permanently on their own by any diet known to man. If you ask Jennifer and any patients like her prior to her surgery, they have been on every diet known to man. They have lost the weight. It always comes back. They are predetermined to be at this weight by a multiple factor conglomerate that we don't quite understand.
Explain
weight
for
loss
us.
surgery.
Yes, just before you go further, I was hoping you could explain for us the difference or the different kinds of bariatric surgeries, because it's not just stomach stapling, right?
There are basically 4 kinds of bariatric surgery that are now available in North America and should be performed. The gastric bypass is the most one performed and is considered the gold standard. But there is also the adjustable gastric banding device. There is the more radical duodenal switch operation, and now there is a new procedure out that is tending to compete against the gastric banding, called the vertical sleeve gastrectomy, because the results with the gastric banding have been questioned by some authors, and a new type of surgery is being designed to produce or achieve the same results. There's no question that the gastric bypass is the gold standard in North America right now.
Then, and just tell us briefly then the difference between, I mean, bariatric surgery is predominantly for morbidly obese individuals. This is not for people that are struggling to lose 10 pounds.
Absolutely not. You're very correct on that. There are strict guidelines for qualifying people for bariatric surgery, although in all fairness, they are being questioned, and the guidelines are being re-examined now to see if the surgery can be offered to those that stand to benefit. But certainly we're not talking about 10 or 20 pound weight loss, but anywhere 50 pound overweight or more is now being targeted with bariatric surgery because of the safety of the procedure with the newer techniques that are available now. This is now carried through keyhole surgery. It's like having your gallbladder removed, and we don't bat an eyelash having our gallbladder out.
And recovery time is much easier. And Jennifer, let me ask you, because as I understand it, it's not that readily available in Canada. I mean, it's tough for people to get. Was it tough for you to get?
I waited about 2.5 years, and that was 4.5 years ago. Right now, people are waiting 5 to 7 years, and they're dying while they wait. There's so many other diseases associated with being obese, and diabetes, heart problems, high blood pressure, cholesterol, and now all this news about the possibilities of cancer. And these people are desperate to have this type of surgery to help them survive.
But then finding the doctor to do it is another thing, right?
Well, it's a general surgeon that can perform this operation, and I think that what we need to do is raise awareness, which is what I'm doing in my coalition, to raise awareness for the plight of the morbidly obese and how what a great number of people are out there that could benefit from this surgery.
Wow, impressive numbers. And you just, I'm looking again, Doctor, 85% reduction in colon cancer in the people that were studied, and 70%, or sorry, 85% reduction in breast cancer, 70% in colon cancer. Fascinating study. Thank you both for coming on to talk about it.
Thank you.
My pleasure.